Welcome to Ask the Doctor series hosted by Emanate Health. Emanate Health will periodically reach out to our physicians to provide updates on important conditions prevailing in our communities. I'm Dr. Gurjeet Kalkat, the Chief Medical Officer and Executive Vice President at Emanate Health. Today I'm joined by...
Hi, I'm Dr. Paul Yang, one of the orthopedic surgeons here and joint replacement specialists.
Dr. Yang joined us about 6 years ago after getting training at UCLA and Cedars-Sinai Hospital. And today's topic is bone and joint diseases in the aging population. So let's just dive straight into it. We're going to start with defining various conditions and how we can prevent and treat those conditions. So let's start with the definition of arthritis. How do you define arthritis and what are different types of arthritis?
Good. Yeah, there's two main types that we commonly see in our clinics. It includes osteoarthritis and rheumatoid arthritis. Osteoarthritis is typically defined as wear and tear arthritis. As we age, as we use our joints, they start to break down and become painful over time. Rheumatoid arthritis is an autoimmune condition where the body's natural defense system starts to attack the joint lining, and that causes pain and damage in multiple joints.
Yeah, we'll focus on degenerative or osteoarthritis. What are the risk factors for osteoarthritis?
The risk factors for osteoarthritis, as you get older, your body's natural ability to repair the joints decreases and they start to break down. And also, if you have any history of injury, microtrauma, sprains, these affect the joints and cause it to become more painful and arthritic in time. Additionally, if you have other comorbidities such as being overweight or diabetes, these can also add and compound to the stress that your joints see.
So that goes into how can we prevent as much as we can, try to do it.
Preventing arthritis is really maintaining healthy weights, active lifestyle, and good muscle mass. And the muscle helps support the joints and to prevent further injury.
We mentioned muscle mass. So how can we maintain our muscle mass and what are the exercises we can do to prevent arthritis?
Of course. So maintaining muscle mass really just needs you have to build a good habit of daily exercise and physical activity. So physical therapy, daily exercise, range of motion, these things help prevent the muscles from deteriorating, from atrophying, and this allows it to help support the joints during normal use.
You mentioned weight. Is that considered the most important risk factor?
Yeah, weight is one of the most easiest things you can control. So if you maintain a healthy weight, your body sees or your knees see like 4 or 5 times your body weight. So for each pound that you lose, your knees will feel 4 or 5 times better.
That's very important to know. What's normal aging versus arthritis?
So normal aging is kind of like when you wake up in the morning, your joints feel a little bit stiff, and they usually feel better and when more natural as you use them, and that minor aches and pains go away. True arthritis is when the joints are painful and stiff, and they actually worsen with use.
Okay, very important to know. Now, let's say somebody has some arthritis. So they usually start with over-the-counter treatments such as anti-inflammatories. Most commonly known medicines are Advil or Aleve. Then we have the supplements. Let's start with these over-the-counter anti-inflammatories, how to take them and what are the risk factors. If you could elaborate on that, please.
Yeah, of course. Over-the-counter anti-inflammatory medications are really the mainstay for pain relief in typical arthritis, and patients can use these by following the directions as indicated on the label. But older patients have to be cognizant and be careful of starting some of these medications because it can have some side effects, including damage in the kidney, stomach, and they should consult with their primary care doctor before routine use of these medications.
Very important.
Yeah.
Now, supplements. So we have supplements like chondroitin, glucosamine. Any comments on that, please?
Yeah, there are lots of supplements on the market, and they are all really that's what they are. They are supplements, and there aren't really good evidence showing that they will help reverse or decrease arthritis or build new cartilage, but they can be helpful in preserving some of the cartilage, and some patients anecdotally say that they feel a little bit better taking these supplements. So they are okay to take. Other supplements like turmeric or omega-3s can actually help with decreasing inflammation, so those are also good for the body.
As you mentioned, in mild to moderate cases,
Correct. Mild to
there may
moderate
be some benefit,
Yes.
not much of a downside, really.
Correct.
Now, once we progress from supplements, over-the-counter anti-inflammatories, and then they still are not better, they come to docs like you, and then what's the next treatment modalities for these patients?
Yeah, so other than the stuff that you can do at home, physical exercise, stretching, maintaining a healthy diet, all these things, and you're starting to have some pain, you take anti-inflammatory medications, and they're still not quite cutting it. The next thing is to see an orthopedic doctor. They will likely prescribe some physical therapy, and if you're really in a lot of pain, the next treatment could be certain types of injections, such as cortisone injections or hyaluronic acid injections.
That's important to know for the community, that arthritis doesn't mean that you should not exercise. It's important that you keep exercising to keep those joints healthy.
That's correct. Yeah, never stop moving. You got to keep moving and stretching, but modify the activities. So maybe if running was painful, maybe progress to walking or biking.
Let's talk a little bit about the injections. There are two different types, as you mentioned, steroids and hyaluronic acid. How do the steroids work, and how long do they last?
Good. So steroids are the steroidal anti-inflammatory medications, so they're very good at putting out the fire, so to speak. It will decrease pain and inflammation rather quickly, but unfortunately it's temporary and only lasts about 2 or 3 months. Hyaluronic acid injections are like a synthetic gel or a lubricant for the joints, and basically it helps indirectly improve pain, but does not actually decrease pain or inflammation. It helps lubricate the joints, and that can help decrease pain indirectly.
All right, so one has tried all this, and then unfortunately in some situations we come to surgeries. We are focusing on hips and knees, mostly knees, because that's the most common joint replacement therapy done for our elderly. So what are the new developments in knee replacement surgery?
Yeah, so hip and knee replacements are really the most common because they are the weight-bearing joints. And as we advance over the years, we're becoming able to do more and more minimally invasive surgeries. So the knee replacements and hip replacements can go home the same day. People are walking the same day. And those are really the latest techniques that we have, combined with good pain medication, good anesthesia, and good surgical technique.
And what's the recovery period for these surgeries?
A typical recovery period is approximately 3 months. But as I mentioned before, right away patients are able to use the knee and start doing physical therapy, so they can start recovering and getting back to normal life.
Okay. And how long do these joints replacements last?
Yeah, so in the modern implants and modern technologies, the joint replacements can last 20 to 25 years.
Fantastic. They used to be like about 10 years.
Yeah, before, the manufacturing process has improved significantly. All the little kinks have been worked out, so they've been lasting a very long time, and sometimes even longer.
Very good. So I'm going to pivot to now bone diseases. The most important bone disease is osteoporosis. So let's talk about what is osteoporosis and what are the risk factors and how we can prevent it.
Yeah, so osteoporosis is the architecture of the bone is getting weaker, and so the structure of the bone is becoming less dense, and so therefore more prone to fracture. So it's really important to maintain exercise, a healthy weight, get sun, vitamin D, and calcium, and these things help prevent osteoporosis.
And what are the treatments available for osteoporosis?
So different medications include, supplements like calcium, vitamin D. There's some bone building and anti-bone resorption medications that your primary doctor can discuss with you, and these can help prevent fractures and bone loss and mineral loss in the bones.
Yeah, that's important to know, because you have to have strong bones, because as we age, there's a risk of a fall, and if one falls, if one doesn't have strong bones, you are prone to developing a fracture, typically a hip fracture. So that takes us to another question. What are the things we should do to make sure that we have a proper gait and the exercises to prevent falls, something like core muscle building exercises?
Yeah, so like I said, maintaining muscle mass is very important. So when you do fall, you're able to get back up, and getting from a sit to a stand position. These things help maintain the core muscles. Physical therapy can help train your core and maintain a good gait. Therefore, you can stay active, right? So and secondarily, if your joints are painful, then maybe you're less and less active, and that could be another factor in contributing to osteoporosis, because you say, hey, my joints are very painful, I can't exercise, and therefore you get weaker and weaker, and your bones therefore get weaker and weaker, and that compounds the situation.
Yeah, as we live longer, what we are seeing is that in addition to exercises like jogging, walking, it's important to have a very, very strong core. And for that, exercises like squatting, if you can elaborate on that, please.
Body weight exercises such as squats or modified squats can help really engage the leg muscles and the core musculature. So you can also carry weights on the arms or wear a little weighted vest, and these things can help improve bone density as well.
So if a patient has tried various injections and they're not working, what are the next steps?
Yeah, so the next step really is quality of life. So surgery is usually an elective decision, but if the pain and stiffness is really affecting your quality of life, inability to walk, ambulate, and stay active, then surgery can be indicated.
Is advanced age a big issue as far as joint replacement is concerned?
Yeah, so when we talk about age, I see a lot of patients say, oh, I'm too old to have surgery. Well, that's a very common question, and I tell them, hey, age is really about your physiologic age. And so a healthy 80-year-old with no comorbidities, they're active, they still enjoy playing golf, they could be a better candidate sometimes than a 60-year-old who has multiple medical comorbidities such as diabetes, heart disease. And so therefore we individualize our decisions based on how the patient is and their physiologic state.
Yeah, so it's important that even if one is elderly, if surgery is needed, you can go through it with the advancements in surgery these days, as long as your heart and lungs are strong.
Yes, that's correct.
Good. So as we age, what we recommend is that you take good care of yourself. If these situations arise, you reach out to your primary care physicians who will manage the medical part of it in the beginning, but then if necessary, you will be referred to physicians like Dr. Paul Yang, who are in your community to take care of your ailments. This has been a very informative session. Really appreciate you coming down here to help us out with all these issues. We look forward to seeing you again. Thank you so much.
Of course. Thanks for having me.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.